A busy Monday morning, a 33-year-old software engineer leaves his home at 9 a.m. and within 5 minutes of leaving his home, he gets a severe chest pain. The previous night he had a party and he's a chronic smoker and has a lot of stress, and within 5 minutes of leaving his home, he reaches he's in front of a hospital, and he comes in and we do an ECG and it shows a major heart attack. We immediately load him with these medicines called aspirin, clopidogrel and statin, and we just give him some pain medications and he starts settling down immediately. Within 5 minutes we get an ambulance and shift him to a cardiac center nearby, and by 9:30 his symptoms have completely settled and he's appearing better. They do an ECG there. The ECG is almost showing a normal rhythm, and the patient also was almost completely better. They took him for an angiogram by around 9:45 a.m. and the angiogram showed almost a clear coronary arteries with a small clot inside which was almost dissolving. They sucked out the clot and they moved him to the ward by 10 a.m. They started him on cardiac medications. Within 24 hours he was discharged, and within 5 days of the first presentation, the patient was able to go back to his work, resume his work without having any problems, and his heart was completely normal. The moral of the story is, if anybody gets this kind of chest pain, they need to be immediately, an ECG has to be done. Second thing is, if you have a doubt, start them on a loading dose of aspirin, clopidogrel and statin. Remember these names, very important. This can save many lives. So this will reduce their symptoms by more than 50%, and also it will save their lives. They can reach the tertiary center immediately, and also the complications including death on the way can be prevented by more than almost 90%. So stay healthy, stay safe, and always remember these drugs. Thank you.